Today we will follow our educational series on infertility, and I'm going to talk to you on IUI, intrauterine insemination of husband's semen. A very simple procedure where we have to basically do the processing of the husband's semen by the swim up or the density gradient, and once it's processed, the whole chunk of the concentrated semen will be placed inside the uterine cavity, that is intrauterine insemination, by a specially customized designated catheter, that is IUI catheter. There are many advantages in mild cases of endometriosis, in PCO, in unexplained infertility, in mild oligospermia, or if husband has got any sexual dysfunction like impotent he is, or if the urologist will give us a semen by the electric ejaculation, which husband will be stimulated by a urologist by the special equipment and the tools which they have, and they will hand over the semen, or in cases of retrograde ejaculation. So in all the cases of sexual dysfunction, in all the cases of the cervical stenosis or cervical pathology, or mild type of endometriosis, or unexplained infertility, mild oligospermia, all are very useful. The greatest advantage is because the procedure is so simple. We will stimulate the patient hair ovulation induction by only tablet. We don't need to give injection. Maybe for trigger we give, and after giving the trigger, once the follicle size is 20 by 20, and we give HCG shot, the recombinant, after 24 hours, the husband should give us the sample, and we will process it either by pressure, density gradient, or by the swim up technique. The count of their processing, that is post-process, should be at least more than 1 million. It means it will give us a good success. The advantages, not only this, because it's very simple, not only it is being used in many of the indication of infertility, but advantages is there is very less stress on the husband mind and the wife mind, because no financial basically pressure or burden on either of them. The success rate is approximately 20%. In our series, you will be getting surprised that many cases are failure of IVF success from other center. They came to us, they had just laparoscopy followed by IUI cycle, and they got blessed and conceived. So it is a useful procedure. So patients should never think that, oh, I am an IVF failure, I will never get conceived. No, it's not that. You go for a cycle of IUI, which is very useful. The success rate is also good. One thing which you have to notice, and you have to give this information to all the patients, is cumulative success rate of IUI is increased to about 60-70%. And if patient has at least 3-4 cycle of IUI consecutively, the success rate it raises. These are the very greatest advantages. But then, multiple pregnancy, one complication or side effect, or maybe abortion, these are the side effects. But it's a very useful thing.